We're back here on the program Jones and Company, and today speaking with Dr. Loxley Monroe and Dr. John Dillett of the Consultants Physician Staff Association. And gentlemen, you are so frustrated over working conditions and money. So the esprit de corps is very low among physicians, isn't that right?
Yes, and I'll tell you again, when the former Minister of National Insurance said the greedy doctors, that was really kind of disconcerting. Everyone was running hot, they wanted to respond. He said, no, leave it alone. And then when the current Minister of Health came in and said non-performers, persons again got very, very upset, because you talk about the esprit de corps, the morale. There are any number of physicians who are so frustrated with the deficits in that system. They cannot deliver the level of care they can simply because the organization do not provide you with what it takes to deliver that level of care.
The point is, they say they can't afford it. They said they can't afford it, but you believe that they can. Is that what you're saying?
I believe, and that's why we talk about those quasi-government organizations. Yes, they have a subvention of $200 million from the Ministry of Health, but they also have, I think, the mandate, the prerogative to be able to bill for services. See, if you billing for services, then you can charge and you can actually collect funds.
But you need to have the facilities in place to be able to bill for these services. The people go to the Cleveland Clinic because they believe that they can get care in what I call commodious circumstances. The atmosphere is different. You have Physician Alliance there. How is that related? How do you work Physician Alliance? That's an organization, isn't it?
It is.
Within the Hospitals Authority. That is a company of private doctors or consultants who are operating in the Hospitals Authority.
Well, I guess we are on national TV or national ethos. Those $1 million that you speak of that the Public Hospital Authority collects, yeah. I can almost guarantee you that Physician Alliance activity in the hospital is what caused those funds to be collected. It is not from the Public Hospitals Authority.
So the $13 million that they collect is through Physician Alliance?
At least $10 million of that, or more, I would say, is because of the activities of Physician Alliance.
Had it not been for Physician Alliance,
they would be collecting about $900,000 a year, maybe $1.2 million a year.
And Mr. Jones, it speaks to the fact that there should be a partnership between physicians, senior physicians, and the Public Hospitals Authority. Persons who have the know-how, the ability to generate service, that is where you partner. But if you decide that you're going to do it by yourself, that you don't have the expertise, and you certainly don't have the track record of success, but yet you refuse to partner with persons who have the expertise and the interest. As Dr. Monroe said, there are persons who are working just because they want to help the people.
And let's go back to Physician Alliance. That group of doctors, and it's not all of the consultants in Physician Alliance, right?
No.
How many in Physician Alliance?
I'm not sure, to be honest.
It's a company of doctors.
It is.
Who are running the private ward.
Yes.
Of the hospital.
Yes.
Yes. I do not understand how they work in conjunction or with the Hospitals Authority.
Well,
what is that arrangement?
The arrangement is that they would run, really and truly, it's more private surgical ward. And so you have the obstetrics and gynecologists, cesarean sections, deliveries, and of course, stuff that I would do, hernias and gallbladders and colon cancers and so. they come to the hospital, and Physician Alliance is responsible for their billings. Now, part of the agreement with the PHA and the government was that half of the gross income that Physician Alliance made, they're going to share with the Physician Alliance and the government. That is why they make their money. Because, and again, to clarify something, the hospital bills on what they call a gazetted fee. And in fact, they don't have the authority or the privilege to use the schedules that we do. Physician Alliance has that privilege. So when Physician Alliance bills for the use of the operating theater, if you come to the public side and you say, oh, it's $120, Physician Alliance could charge $1,200 because they're going to be billing a private insurance.
And out of that $1,200, they share
$600
with the hospital's authority.
Precisely. That is why it makes sense to partner with the physicians, because if you have more physicians using your facility, billing according to the standardized protocol, your organization would not have to be begging and parasitizing the consolidated fund entirely, because you would actually be able to garner revenue on your own. And again, just to let you know, and folks out there, in any hospital bill, 15% of that total bill is physician, 85% belongs to the hospital. Okay? So if you get a bill for $10,000, I am going to get $1,500 out of that, and the hospital is going to get $8,500. That's how the system is set up. See?
So doctors, what you're saying to me is, you talk about devolution, right?
Yes.
We have a healthcare system which has been dominated by the public sector, by the government, right?
Yes.
Which has resulted in a bad business model. You need an updated business model to reflect, as we speak on this program over and over, the realities of a 21st century country. Right? We're operating with an old model which has resulted in millions of dollars leaving the country.
That is absolutely correct.
That's the problem.
Correct.
So the model needs to be changed.
Yes. And there need to be more interaction with the experts, the technical persons who are going to be able to improve your revenue capture. See? And I know they would say that we have put in an industrial proposal. They say we make it demands. But I can say to you that more than half of that proposal speaks to physicians having a more impactful role in the decision making in the organization. That is a huge part of what the industrial proposal covers, that we would like to have more say in the quality of care that our patients get, not having to listen to persons who have no idea how to solve a problem when the patient comes there, have no idea what the patient is complaining about. I listen to complaints every day.
Why would the board of the hospital's authority not involve you, or why do you have such difficulty getting through to them? You've been negotiating for years on certain things.
That's an excellent question, Mr. Jones. One has to ask, what is the reason? And I think you have to look at the layers. To whose benefit is it to keep the system as it is when it's not working? Because certainly the physicians, the nurses, we all want the system to work. We see persons suffering in our system. And so we have offered many, many solutions to try to fix that system. Yet we're being ignored. And I can't answer that, Mr. Jones. The question is why? Why would those who have the ability to make policy not listen to the nurses, the junior physicians, the senior physicians who are on the ground seeing these troubles day by day, and yet they ignore us?
Dr. Monroe, you said that you haven't had salary increases for consultants for 10 years, for a decade.
More than 10 years.
More than 10 years.
Yes.
Why it took you so long to?
To actually say something?
Yes.
Again, Mr. Jones, that is really a fundamental question. When we wrote about those things, the managing director for the hospital authorities wrote back and say, you don't have no voice.
You have no voice.
You have no voice. We don't recognize you, even though we had formed this organization in 2001. He say, who are you? We don't have to listen to you, okay? And again, Dr. Dillard can say, I could let you know this, but when we actually, in 2013, when we actually really, everybody really got the passion now, we have to be able to speak. Then we had to go through the whole process of forming a union. So CPSA is a formal union. That took about a year plus to go through Ministry of Labor, to go through Cabinet, Parliament, and the Attorney General's office. And again, even though we had our stamp from the Ministry of Labor, when we submitted our industrial proposal, the first thing he said is, are you the sole bargaining agent for the senior physician? Of course, being naive about union matters, I didn't know anything about that. So, well, how do you become the sole bargaining agent? So we had to go and do that. So then they recognized us August of 2016 or 2017 as a sole bargaining agent. And as that negotiation process started, one of the first thing that came up was, you don't have agency shop. Agency shop? What is agency shop? Right? So,
No, you didn't take advice from the TUC?
well, again, and Mr. Opie Ferguson will probably fuss me out for this, but because of our professional commitment and our so-called Hippocratic oath, what the body did not necessarily want was for any particular unrest, that all of a sudden, let's say the hotel union decide that they're going on strike, that you're going to say all, because we are part of TUC, we are all going to leave our job. I think that would be very unsatisfactory for most physicians. If you just go along with all the other bodies, not that we don't support them, but it would be very, very difficult to say to physicians, forget it, they go on, let's go. So we have a relationship with them, and I think in speaking with Mr. Ferguson, he understands our problem, our moral and our ethical problems with just arbitrarily stepping off from our responsibilities. So yes, we have taken advice from him and some other folks that we got these things sorted out eventually. But the PHA refused to recognize us before they delayed the whole thing simply through this whole business of recognition as the sole bargaining agent. Do you have agency shop?
But you are recognized now.
Yes, we are.
And so you propose now to take some action on this whole list of grievances that you have.
Yes.
Yes. And one is salary, the other working conditions.
No pension plan.
No pension plan.
No health insurance.
Why should the government provide you physicians with a pension plan? You are also in private practice, aren't you? All consultants can do private practice. Why should the public treasury pay your pension plan?
If a public officer holding a pensionable office who has not completed the period of service, which should, the authority shall establish a pension scheme for the payment of pension and gratuities.
Where you got that from?
This is part of the statute law, Pension Act. Okay? So they have a responsibility to establish a pension plan for their employees.
But you're not a full employee of the
PHA?
of the government.
No,
are
the
you?
civil
Not
service.
the government.
Of the civil service.
No.
But this speaks to the authority.
No, but the Public Service Commission doesn't appoint you.
No.
So why should you have a pension plan?
Because
if you're
that-
not a full public servant.
That is part of their mandate. The authority shall establish That's part of the
The
act.
Public Hospitals Authority.
That's right. The act says the authority shall establish a pension scheme for the payment of pensions and gratuities to officers and servants of the authority who retire from the employment of the authority.
But you're not a full-time employee of the Hospitals Authority, are you? You're a full-time employee?
You do have
You're
some
a
persons who are
consultant.
full-time employees.
You are a full-time
They
employee?
are 40-hour consultants, yes.
So you work 40 hours a week?
There are some that work 40 hours a week. There are some that work 20 hours a week.
So you consider yourself a full-time employee of the Public Hospitals Authority?
Well,
Persons are also on call multiple times a week. Yeah.
again, let me say something.
No, but you see, if you have your private business, your private clinic, your private office, and you can take as many patients at your private enterprise as much as you want, and you are a consultant to the PHA, should the PHA be paying a pension for you? Shouldn't you, as a private doctor, organize your own pension scheme?
That is a reasonable question, but I'll say this before that. We, as consultants from the Ministry of Health, we had our pension plan from the Pension Act. And when we were appointed as consultants, the first thing they said to us was, we cannot afford to pay you as a 40-hour consultant. Therefore, we are going to pay you only for 20 hours. 20 hours. That is the situation that they set up. They also fix it in such a manner that they are supposed to have a pension plan. That wasn't us. That was them. They said, we cannot afford your services for 40 hours. You're going to be a 20-hour consultant. And what that did, literally, when I became a consultant in 1995, my salary was $42,000 a year. They immediately cut my salary by $7,000. My salary went to $35,000 a year.
35,000.
Yeah.
Mr.
A
Jo-
general surgeon like
Yes.
Mr. Jones,
and you work around the hospital about 100 hours a week.
Mr.
Huh?
Jo-
I don't even call them.
You don't.
I don't call them.
But Mr. Jones, that's the point too, that the physicians, for their level of service and expertise, are so grossly underpaid that you have to look at the contribution to the nation that they are making.
Yes.
The fact of the matter is, if the consultants were only after making $1, you would have no consultants in the hospital because they cannot pay you for your time, not even close. And I can tell you from my own personal experiences, it may take decades, in my case, 14 years of tertiary school education, and hundreds of thousands of dollars to get those level of skills and to set up an office and to do all these things. Extremely expensive. The work that we do in the hospital, it is for a fraction of what it is worth. And we are not asking to be paid what that value is. We are only asking to be fair and reasonable with us and recognize the contribution. We are saving lives. We are working in horrible conditions. It doesn't matter who you are, where you are on the scale. Does anyone deserve to go without a raise for 10 years? If you are working in a place that you can potentially get an illness, an infection that could kill you, should you not be having health insurance? If you are so undervalued and paid, should you not get some form of pension so that when you have retired and you have given so much to the community that you have a little something for yourself and your family? You may hardly even see your wife or your children because you are working. When there is a natural disaster or natural emergency, the consultants don't say, well, I'm not on call, so call someone else. We mobilize everything that happens in this country. We are a part of. And it's the good nature of the people as to why it's taken this long to get to this point. It's because they took advantage of us. We were naive. We didn't understand. We're good-natured. But now as you got slapped around a bit and you realize, this is what actually we should stand up for ourselves. We have the right to be like everyone else, and that's to be treated humanely and fairly.
We have to take another break, our final break here, gentlemen. Dr. John Dillett and Dr. Loxley Monroe are our guests today. We will come right back.